We're really moving from healthcare that is really based on chemistry to healthcare that's based on energy.
There's an energy and electrical component of a healthy cell, and then one that's dysfunctional, that's sending pain signals, and that's not healing. And I think laser does this. We get really acute with this in terms of what types of energy need to be on what types of cells. Hey everyone, Derrick Hines here. Welcome to the podcast where I'll share with you the patterns, insights, research, and technologies that we use in my own pain and performance practice to help people improve their health, speed their healing, and increase their longevity. Thanks for listening. I hope you enjoy it. Dr. Rob Hanopole, welcome to the Pain and Performance Podcast, man.
Thanks for having me. I appreciate it today.
This is a topic that all of our listeners are going to at least have like a cursory understanding, and I'll like catch you up on this. We've talked a ton about regenerative therapy on here. We've talked a ton about advanced technologies. But one of the reasons I was very excited to connect with you and get you on the podcast is we actually haven't done a deep dive on photobiomodulation, laser therapy, high intensity laser therapy, all the questions. There's so much out there on this in terms of like differences, and now it's starting to become the buzzword. And so like now you're getting marketing terms thrown in there, and like the consumer is saying like, wait a second, is this the same panel thing I get at home?
Exactly.
What's the difference in all this stuff? How does light help me heal? There's all these kind of questions that come. So I was like, all right, I think, after years of having laser therapy in the practice and getting it, being one of the first to get it in this community, it was time for us to do a really good deep dive on what is it, how's it work, what's it work for. There's all kind of fun research coming out on that. So welcome to the podcast.
Thanks for having me. And, when you said that, I was thinking two things. I was thinking red light therapy, and everyone thinks that laser and red light therapy and, LED panel, I think it's all the same. And whenever I talk to people about laser, they're always thinking, oh, you do red light therapy. I'm like, that's just a wavelength. So between laser and red light therapy and the panels and now peptides, it's like there's so much consumer confusion out there with everything. But listen, on the good side is that there's so many things out there that can help people heal naturally without the drugs, without surgery. Our motto is ditch the drugs and skip the scalpel, and we live by that. And the doctors that I work with, they carry a little challenge coin in their pockets that say, ditch the drugs and skip the scalpel. So, we really have a mission. Here it is right here.
There you go. Okay. I like that.
You see, a little ditch the drugs and skip the scalpel.
Quick reminder. So let's break that down. So let's start kind of by unpacking the field of photobiomodulation into your red light therapy all the way into laser therapy. What's the differences among those?
Well, first of all, red light it's a wavelength, okay? It's not power, okay? It's a wavelength, and it's in the 600 nanometer spectrum. You have a healing spectrum, okay, between about 600 nanometers, and we were just talking before this, around 1200 nanometers, okay? The longer the wavelength, the deeper the penetration of light, okay? So everyone, thinks that laser is this red light, but generally on the lasers that we use, okay, because they're surgical powered lasers, but they're fitted with lenses and handpieces that actually, spread the beam, so it's not going to cut, and it's not going to cauterize, it's not going to destroy tissue. It actually helps tissues to heal, okay? But red is really, again, on that lower end, and with the lasers that we use, the red light is really just there for two purposes. One is for more of the superficial issues, and I have a case that I could talk about with the red light that just blew my mind, okay? It was the most miraculous case I've ever had in 31 years of practicing. And the other use for the red light really is just really more of an aiming beam, just because The wavelengths that are really doing a lot of the healing and penetrating very deep are in the near infrared or infrared spectrum. So that's why, with a class 4 laser, which is a powerful laser, even a military weapon would be considered a class 4 laser. Okay. But we have to wear glasses. We just had a big safety, laser safety Zoom call recently for the doctors that I work with. But you have to wear glasses. The practitioner has to wear glasses. The patients have to wear glasses because it could potentially cause damage to the retina if the laser gets directly into the eye. It's unlikely, but again, there are safety precautions with a class 4 laser.
So when we're looking at that, it's like, okay, there's everything from 600 to 1200, 1300. That changes the depth of it. And when you look at like panels, full body panels that are usually in that lower, much more red light and like maybe the early nanometers of infrared light, does it change? I know it changes the tissue that it targets. Does it change the effect of it? Is it doing something different if someone's using those versus someone doing a high intensity class 4 laser?
Well, typically the panels aren't laser.
Correct.
Typically the panels are what you would say LED. Okay. And the difference between laser and LED is that the LEDs are diffuse, okay? The light is not going in very it's not focused energy, okay? And generally, the power is a lot less. A lot of people confuse the power with depth of penetration, and that's not really how it works. So let's just say you have a red light panel that's 660 nanometers, okay? And it also has some near infrared. Let's say it has 810 nanometer infrared LEDs. Well, they're going to have the same effect on the tissues. However, when you don't have the power, I guess the best example I can give you is this, Danny. Derrick, if you were, you had the faucet and you're filling up a pitcher, and you put that faucet on as powerful as it can. That would be, let's say we're using a 30 or a 45 watt laser, or we could say 45,000 milliwatt laser, okay? That's filling that up fast. And when you use a high powered laser, you're getting more photonic energy coming out of the laser, just like you're getting all that water coming out of the faucet. And let's say though, that's at the same, we'll just call it a wavelength as an LED panel. But the LED panel, let's say, is a lot less powerful. So you're getting less photons coming out, or you're getting less water. So you may get you may be getting a drip out of the faucet to fill the cup or fill the pitcher versus all that water coming out. So really, the way I explain it to patients is, we're using a very high-powered laser, and this is an injection of energy instead of an injection of chemistry.
Yeah.
So, if you were getting a PRP injection or a stem cell injection, or, listen, I always say, God forbid, cortisone injection. We have a lot of issues, with that. But if you're getting an injection, typically an injection would be 5 seconds, right? Unfortunately, the laser is going to take maybe 5 to 7 minutes. But we're injecting that energy with no needles, no pain, no downtime, no negative side effects. But it's very powerful, okay? The LED panels generally don't have that same power. And you don't have that focused light, okay?
Yeah.
It's diffuse. It's not converging in one area. But I like the LED panels for certain things.
Yeah, I like the analogy of the faucet really filling up, and then you're like, if I have a problem, if I have one empty cup and I put it under that, I can fill that thing up really well.
With the laser.
With the laser. If it's the panel, spread that water out where it's like little drips over this giant surface area. You might be getting water dripping all over, but that 1% problem cup that's not full might take quite a while to get enough into that one. I kind of like that. I can picture that where that's like, it's still affecting a bigger surface area, but it's just putting a little drip on it. So if you
Drips,
just
right.
need a
So,
little bit of wetness over all of it,
right.
the panel does a decent job.
Exactly. What we could do with a laser in 7 minutes may take a panel 5 hours.
Yeah, right.
Okay. But again, there's a wavelength, and they
Yeah.
have the same physiological effects on the
Let's
body.
talk about that part, because I think understanding, you talk about the injection of energy, understanding the levels that works on, I think is really where practitioners get excited, and where patients understand that this isn't magic. This isn't, in this kind of theoretical world. This is going to change your physiology. Let's talk about what that injection of energy actually does inside the body.
Absolutely. Your body, my body, everybody's body is really made up of batteries, cells. All right, cells are the batteries of the body. That's where energy comes from, right? The mitochondria produce ATP. I think that the body has approximately 50 trillion cells, all right, and they all have volts of energy. Areas where you have chronic injury, those batteries, those cells are not producing enough energy to help the area to heal. So what the laser does at specific wavelengths, we typically use, we have the aiming beam and the guide and the superficial with the red, okay? But, we generally use 810 nanometers, maybe 915, 980, 1064. They all heal. They all have different attributes, to the body, but they penetrate deep into the tissue. And when you're targeting, like let's say somebody has, medial epicondylitis, golfer's elbow or something like that. When you use the laser over the tendon, penetrates into the tissue, and every one of your cells has light receptors, and those light receptors are called chromophores. As a matter of fact, we're finding out through science now that cells communicate through light. That's one of the ways that cells communicate. It's fascinating. Or at least it's fascinating to me.
Yeah.
Live, eat, and breathe this stuff. It just, I go home at night from work and I walk in the house. My wife literally says, I don't want to hear another laser story today. It's like we have amazing things happening every day. So the light penetrates really deep into the tissue and gets absorbed by those chromophores. The one that we're targeting is what's called cytochrome C oxidase. And think of a chromophore in a cell like a solar panel of the cell. And through a photochemical process, a photochemical reaction, very similar to what you would see with photosynthesis, how sunlight affects plants. The laser gets absorbed, and those chromophores are at the level, cytochrome C oxidase is at the level of the mitochondria. So it turns that light energy into cellular energy, and the cell produces more ATP, and this increases cellular metabolism. It speeds up the healing process, and it speeds up. I saw with my own eyes. If I could just tell you one of the cases I had, it really was mind-blowing. But I saw on the surface what laser really does on, deeper into the tissue. Because I had a patient come in. She was a nurse. And it was a very unusual situation because my staff came, back to my office and said, Doc, they said, we have a new patient here, and she's in the reception area, and she's crying. She has tears coming down her eyes, her face. She was literally crying. And I said, wow, she must be in a lot of pain. So, I went up front, I greeted her, and her name was Karen. And, I said, how can I help you? What's wrong? What kind of pain are you in? She says, I'm not really in pain, but emotionally, I'm distraught. I was just told I have to have 2 toes amputated because she had diabetic ulcers on 2 toes. And she was so upset about this and said, do you think you can help me with the laser? Now, this is one of those cases where I didn't know if I could help her. I mean, you do have
Yeah.
limitations of matter, right?
Right.
I mean, sometimes
Yeah.
something is so far gone, the body isn't going to respond. It can't respond. You have to get it before that point.
Yeah.
So I don't like, I like to manage expectations. I didn't want to tell her I can help her. If I didn't feel like I could help her, I said, listen, I said, I don't know. Unfortunately, I don't know at this point if I can help you. I mean, they already told you, the procedure they want to do. And I said, but if you want to try it, I'm willing to try it. But you have to understand, I'm not making you any promises. All I could do is I can promise you that I will give you my best effort. Okay, I'll do everything possible to help you. But I just, I never guarantee results anyway, but I just can't tell you that I know it's going to work, but, she said, you know what, let's try it. Okay. I mean, what do I have to lose? And, she actually said to me, I always remember this. She said, she apologized to me because she's like, I'm so sorry. I know they're only my toes. And I was like, Karen, it's your body parts. Nobody wants to lose, a body part. I mean, it's completely understandable. I mean, I would feel the same way. Okay. This is at the time that I didn't really have class 4 laser. I didn't have as powerful of a laser. Okay. I had what's called class 3B.
Yeah.
The difference is a class 4 laser is any laser that is 500 milliwatts or greater. And typically now, I mean, in the office, we're using, 45,000 milliwatts.
Yeah.
We even have a laser through one of our distributors that's 130,000 super pulsed watts, which is like a billionth of a second. Okay. So you don't even really feel, any heat or anything, but it's pretty amazing, the penetration you get. But with her, I didn't need the penetration because it was more superficial.
Right.
But I used, I think it was 660 nanometers and I think 880. One of my older lasers. It was not very powerful, but I didn't need the power. And I had the right wavelength. And I have to tell you, it was about 9 treatments. They completely healed. Completely. It was one of the most miraculous things I've seen in the office with laser. And what was great about that, I developed a great friendship too. Her husband became a great friend of mine. I mean, he was so grateful, so happy. We go out to lunch all the time. And he tells everybody, like, hey, he saved my wife's toes, and I'm like, that's not necessary. We don't have to get into the whole. But it was really like that got me so excited, back. And that was a while ago, but that's before we even had the class 4 lasers.
So on top of you hit that and mitochondria, absorbs that and starts to pump out energy. On top of that part, what else do you think is happening in there? I know there's been a lot of like this, working on all these different levels. What else do you think's going on there?
Well, there's an immune response. Okay. It definitely helps, with that. Collagen production, angiogenesis, or what you call neovascularization. So, the blood vessels, actually the body develops more blood pathways, more circulation, oxygenation to the area, literally everything that's needed for the body to help the area to heal. I've even read somewhere where it helps to recruit stem cells, to the area.
This is where I get excited about this. I mean, listeners to this will know, like, my brain automatically goes to like, if something's good, can we make it better?
Yeah.
But like we talk about how important mitochondria is to healing, long-term health. This will be a fun part for you. I just did a research breakdown on this long-term study that they did on one woman named Maria Morera. Have you heard that name before?
No, I haven't.
When Maria turned 100, they were like, we're going to start studying this woman and see what's going on. Because she didn't look like the typical healthy 100-year-old. Like, her cholesterol was a little high. Some of her blood levels weren't perfect. She was a little bit overweight. And they were like, but she's 100 and she's healthy and she's moving and she's active. And so they started studying her. And she passed away in 2019. And she was 106 17 or 118. And they found two things that stood out crazy above everything else. She never developed inflammation. Like systemic inflammation stayed incredibly low, even at that age.
Well, that's the
And
big
her
thing today.
mitochondria function throughout her body, they said even when she was 100, it was like that of like a 45-year-old.
Yeah.
Her mitochondria continued to pump out energy very effectively. And so if we look at some of those cases, you're like, all right, our mitochondria are like, this is how we power everything, the healing process included. And there's all these new studies where people are looking at this from a chemistry standpoint of how to help improve the mitochondria. So if we're working on that, I'm like, okay, there's certainly there's peptides. There's been a lot of studies on urolithin A starting to say like, hey, this helps like kind of feed the mitochondria. You look at NAD, improving mitochondrial function. Where do you think the blend of like the compound addressment and the energy addressment should meet? Like, when do we need to double stack that? If like, you take your, typical tendon injury or something like that, and you're like, does it depend on how long the mitochondria have been dysfunctional? Do we know if the mitochondria is dysfunctional? Have you seen better results by adding in a compound that improves mitochondrial function while we do laser to improve the energy output?
I'm sure it would help, but we haven't found the need to do that. I mean, again, I've been reading also a lot about NAD, things like that. And, listen, if you lay in one of these, not laser, but let's just say these LED beds, okay, that are out there, that's something I would like to get for my house, right? To increase the mitochondrial function, in the whole body. But for the chronic injuries, because laser is so focused, because it is so powerful, and we're really focusing on one area, let's say, right? Somebody's coming in with a shoulder, a knee, an ankle, a foot. We're just really, it's very location specific. We're not really, working let's say holistically, on the whole body. But if that was the case, I think it would be great, yes, to really enhance, or look for enhancements of mitochondrial function for the body, again, for longevity and, the better quality of life. We're typically, working with, specific injuries.
Yeah, I'm glad you brought up the ulcers. One of our kind of, from a picture standpoint, I think it's just it's easier for us to get it when it's in a picture, right? Like if we had a patient who had severe wounds and blisters all over his legs, and if you look at the pictures, you would think it's a lie. I mean, it's kind of what you're saying. It's like they were so severe. Within 7 days, it was like these look like different legs. And within laser? 14 days, we used laser on it. We used infrared panels on it. Mm-hmm. And we used PEMF. So, I mean, like, we're really trying to help this. It was a very severe case that we were very worried that if it continued, infection would become a problem, and then it could really be something that was life-threatening. So, but in 14 days, it's gone.
Yeah, it's incredible. I mean, listen, I really believe I see it, not even a belief, I see it. We're really moving from healthcare that is really based on chemistry to healthcare that's based on energy.
Yeah.
And that is definitely the shift. One of the doctors I work with just made a mention, I don't know what it was the other day, something about Star Trek, right? And I thought about it, and I was like, wait a second. Didn't Dr. McCoy, they called him Bones, right?
Yeah.
Didn't he use some kind of red light when somebody had, some kind of injury or issue? I mean, how did they know back then when they were filming this, this sci-fi, that was going to be the future?
Whoever was informing them did some really good stuff.
Yeah, it's amazing, but they know, like, where we're moving, towards. But yeah, that's what he used to use, a red light, to help tissues and injuries to heal.
Yeah, I am very interested in this whole movement towards, bioelectric medicine, seeing what they can do. I think it's Dr. Levin's lab. I think it's Stephen Levin who's doing a bunch of mapping of the energy that cells put out. And if they just take that map and they put it on other cells, now they've done this in like animal models, and I think it was initially done in worms. They take the map that the cells create when they're growing the worm's head. And we don't know what the cells are doing. We don't know anything about that. We're just taking the bioelectric map and we drop that later on other cells and they grow a new head.
Wow.
And so I'm like, all right, like he's like, look, we for years we've tried to figure out exactly what they were doing and what they're sending. And now we're realizing maybe we don't need to do all that stuff. We just need to look at the energy and electrical components of it, and we can figure out, hey, there's an energy and electrical component of a healthy cell, and then one that's dysfunctional, that's sending pain signals, and that's not healing. And I think laser does this naturally. Our body kind of knows what to do with it. My real thought is that there's a level in the next 5 to 10 years where it's like, we get really acute with this in terms of what types of energy need to be on what types of cells. I think there's a potential for us to take one more step with laser therapy and bioelectric medicine as we're starting to study it better. Because it's like, if you pull the studies now, you're just looking at like, does laser work versus manual therapy, or does laser work versus shockwave? And it's like, but we haven't gotten into the minutia of like, yeah, but what if we just move these little parameters
or change the wavelength a little bit? And what does 810 nanometers do versus 830 nanometers or 915? We know there's certain things that they do, but listen, this is quantum physics if you really think about it, right? I mean, it's energy. What are our bodies? Energy.
Yeah.
From a quantum physics standpoint, right? What are we, like 99.9% just energy and information? We're not even solid matter. An analogy I heard, was that if you think of like a high school football field, okay, and you have the track around the football field, okay, and then you have a few ants, moving around the track, on the outside of the track, and a couple on the inside, a couple towards, the center of the football field. That is like an atom, where the solid matter is so infinitesimally small, but there's just more space. There's more energy and information, and it's hard to fathom that, because we think that we're solid, but it's only because we're vibrating so slow. So laser in again called photobiomodulation, really affects that energy field.
Yeah,
it's incredible.
I don't know the answer to this, but as we're talking about it, I'm like, have we thought about this? What does laser do to like resonance of cells? Is that something that you've ever looked at or thought about? Or do you know of any research on that?
It affects it.
That's an answer. I agree. I think it does affect it as well.
Yeah, I mean, it definitely has to, affect that, but I don't know. I don't have the answer.
Yeah.
I mean, we are doing some data, collection right now with laser and orthobiologics. Okay, so for instance, our chief medical officer of my group, Relief Now Laser Centers and the Laser Masters, is a board certified orthopedic surgeon. And he has a research department, and what he's doing on the non-operative cases and even in the post-operative cases, if he recommends orthobiologics like platelet-rich plasma, stem cells, exosomes, things like that, using laser also to enhance the process, to accelerate and to amplify the results, and really, go through that data and, see what the results are there. So, we're looking into all this, but from a, cellular, atomic resonance, I don't have, that kind of information, but I surely would love, to find that out.
Yeah, I feel like I don't know that that's even been looked at. That's why I bring it up, but I'm like, kind of as we're talking about these deeper mechanisms, I feel like that's on the radar of like it starts to change the mitochondria output. If the mitochondria output changes, the resonance and the vibration of all the cells in there is going to change. And I feel like that's what, as we talk about studying these things better, it's one of those things that we just probably haven't looked at to the deep enough degree of like, hey, what resonance is the best? What different, wavelengths change the resonance in what way? Sounds interesting to me. I love the combination of this with orthobiologics and whether that be PRP. I love it with peptides. I know there was a study done in 2024 maybe to show that when they paired laser with orthobiologics, I think stem cells and PRP were the main ones. They showed better cell proliferation, better collagen production, lower inflammation, better blood flow, which we know that
the laser does that, right?
Right. So I'm like, in my standpoint, if you're going to pay the money to do stem cells, we should give that environment every chance we can to help those cells proliferate. If you're going to go and get PRP done on a, chronic tendon injury, love it, but that alone might not change that environment enough and give those cells enough energy to actually go in and repair. To me, part of this, I want to see the studies, but I'm like, it seems like what we currently have is that in these chronic cases, that should be kind of standard of care to some degree to me. It's like if you're doing that, but you're injecting stem cells in this poorly energized and vascularized environment, those cells don't have a great chance to proliferate. If you're doing PRP in that same environment, I think you're going to get very poor outcomes unless you go and do something that helps that environment integrate those cells. What's your
put the patient
thoughts
in
on
the
that?
best put the patient the best opportunity to heal. And if we have that technology, if we can do that, then that's what we should do. But we definitely should be doing, more studies on that.
One of the areas that I'm excited to explore, I'll kind of show my naivety with it, is using laser for brain function, like cranial stimulation. When we look at that stuff, I have a lot of questions around it in terms of, obviously research, but I've heard wonderful things around, different practices starting to do, transcranial photobiomodulation and finding ways to get in there, working on post-stroke injuries, brain injuries, post-concussion injuries, and then even up to just like generalized cognition and memory.
But dementia, Alzheimer's, autism, okay. Matter of fact, the mother of an autistic child, when she's not a child anymore, because this was several years ago, called me last week just to follow up with me. And we were seeing her daughter using laser, okay, over the cranium, because the skull is permeable. And, we were using a certain frequency, and obviously, we didn't want to heat up, too much. We didn't use too much power. And I told the mother, I said, listen, once again, we're not doing this because we're going to cure her autism, but let's just see if she has a better quality of life. Let's just see if there's some improvements. Let's see if the function is better. So her mother, I said, listen, just get a notepad and just, notice if you see any changes, throughout the following weeks. And there were positive changes, just in her ability to, maybe sit still, follow direction. I don't have the whole list in front of me right now, but I asked the mother to actually give me, the list, and it was pretty incredible. So the mother called me the other day, basically, just, to say hello, and her daughter's still really doing well. Definitely saw, a difference. They're doing tests and research right now, like I said, on dementia and Alzheimer's. There's a manufacturer out there that makes these laser device that goes, over the head to hit certain parts of the brain, and they're doing a lot of research on that right now too. fascinating. Again, it's regenerative medicine using technology and energy versus chemistry.
Yeah.
It's really what it is.
In a case like that, like let's for the practitioners listen, what does that look like? Like how often, what are they targeting with it? Are they trying to go through the base? Are they going through the mouth? Are they just going through the parts of the skull that they feel like we can do it? What would the protocol look like for
Yeah,
something like
so
that?
with my, hold on one, I'm sorry. With my organization, we have clinical advisors, and this was definitely a case that, I sought out the advice of, clinical advisor. The first thing was, should I even do this?
Yeah.
What do you think? So, gave me some parameters. We went over different parts, of the skull, just to see if there were any changes. Like I said, we didn't use too much power and specific hertz frequency. And I just followed their direction, And but again, it was anecdotal in terms of the changes, but the mother was making notes.
Yeah.
And it was fascinating. We did a lot over the frontal cortex. I was amazed, though. The mother was very happy.
Yeah, I mean, even in that case, you're like, it all starts with some of these things where is it plausible, and then it starts in case studies, in anecdotal, individual case studies, and then obviously we progress out. But even shoot, as recently as last year, there was a full meta-analysis on transcranial photobiomodulation that showed improvements in cognitive impaired patients. And I think as we've talked on this, it's like it's in almost every field, but I feel like we've had such a focus on chemistry for the last 100 years, and it's only been the last.
Well, what do you think that is? That could be a whole nother podcast.
I was about to say that's a can of worms. I would say start with money, and then we'll funnel down from there.
Yeah, exactly. There's a lot of money in chemistry. There's not a lot of money in light.
Correct.
Okay, because laser, it's light. Listen, you go out in the sun, and everyone tells you to stay out of the sun. Well, listen, I'm here to tell you, a little sunlight is good for you on a daily basis. Okay, you don't want all those UV rays, but it's really healthy to get the light. And you're also getting the light in the healing spectrum that we spoke about, right? 600 to 1200 or 1300 nanometers. That's really healthy for you. I mean, you need sunlight to produce vitamin D in your body, right? I mean, what were some of the first words, if you're a religious person or not a religious person, but some of the first words that you heard, right? What'd they say? Let there be, wasn't it like let there be light or something like that?
Sounds right to me.
Right. So, light energy heals, but again, there's certain spectrum, certain wavelengths that are healthy and other wavelengths that aren't healthy, right? So laser is what you'd call non-ionizing radiation. So it's actually healthy for the body. It's stimulative to the body. It helps the body to heal. And I'll tell you, we were just talking about the transcranial. I'm looking at a couple of these units right now just to use for myself to keep healthy, as I age. I want to set up a whole laser room in my house.
I mean, you'll get this. It's not to beat a dead horse, but it's like I think the stacking stuff is where it's like, man, it's so exciting. So when you look at the data on hyperbaric oxygen therapy,
right.
And brain health, just sustained brain health, but really everything. The studies just kind of continue to pile on, and being able to take something like that kind of comes at this from a different direction. And, you do get stem cell recruitment. We get, definitely increases in blood flow and oxygen delivery to all these tissues. But if you could take that and combine that with some of the early protocols on transcranial laser therapy, transcranial PBM, that's what I would want if I'm in that situation. And then I would probably want, hey, give me some dihexa and some P21 and some Cmax in there, and like let me check these boxes as much as we can from
complete longevity, right?
Yeah.
Longevity, peak performance. I have so many great technologies, and we have so many, nutrition, through nutrition and laser and these other technologies. It's amazing what we have, and the stacking is great. There's a center that opened here in Florida recently, and I walked by after having a dinner, and I looked at it, and it had all these really cool, it had a hyperbaric oxygen, had shockwave, had laser. It even had like a laser. No, had the hyperbaric for, okay, but it had all these technologies, and they have like a membership, and they even have like longevity parties, right? And you can go and you can rent it out, so instead of going to a bar and putting all these toxic chemicals in your body, you could actually have a party. It's a beautiful center. I was like, oh my God, this is like amazing. And you can go do all these great, longevity treatments and athletic performance treatments. That's the direction that things are moving right now.
Yeah. Stay tuned, listeners. Y'all, there's going to be longevity parties coming to Lafayette, Louisiana.
There you go. I gave you a good idea, right?
That's good stuff. I'm glad you brought that up, because like one of the things we're constantly doing is like talking on this show, and people talked about marketing. People are getting marketed to regenerative therapies. You're always trying to figure out, like, from an efficiency standpoint, time and money for the consumer. And where I started to really think that the energy part of things was more powerful than the mechanical part of things was looking at the research between high intensity laser and shockwave therapy.
Let me ask you a question. When you say high intensity laser, what do you mean?
Class 4 laser, above 40 watts would be my starting point.
It's funny because when you say that, I hear people say, they call it like high intensity laser, powerful laser, hot laser. Again, there really needs to be one standard nomenclature, one standard way to describe it, because like even companies will say high energy laser. Okay, but what does that really mean?
Starting to market it.
Because there's companies that will say things like, well, look, we use the green and purple and lavender spectrum. They're more energetic. But here's the rub. Okay? Yes. They are more energetic to the cells. And these are in the shorter wavelengths, okay? They are more energetic to the cells. No doubt about it. But guess what? Why do you see blue? And why do you see green? And why do you see lavender? Because they're not penetrating.
They're not, yeah.
They're reflecting. So, from a marketing standpoint, yeah, they're more energetic. But if you're not reaching the target tissue and giving the target tissue that deep tendon, okay, you're not giving that target tissue a therapeutic dose, you're not doing anything.
If you look up, if a listener goes on PubMed right now, you look up low level laser versus high intensity laser versus PBM, do you know like what researchers consider high intensity laser? Because like that's where that comes from. Like the title of some of these studies is high intensity laser versus blank.
Yes.
Yeah, what is their definition of it in research?
I would say probably class 4.
Yeah. I mean, that's my guess. You said that and I'm like, I know in that study it was class 4 lasers, but we bring that up, and I think of Seth Godin's thing. He's like, marketers ruin everything.
So we put a trademark after. So what I really thought about that is, what would you really describe laser? Okay.
Yeah.
So there are two things that we call it. Okay. I use two different descriptions. One, regenerative laser therapy. Regenerative medical laser. Okay, because it's regenerative. It's regenerative medicine using energy instead of chemistry. It's a registered medical device, and it's laser. Okay, we call it regenerative medical laser, TM. And then we also call it medical laser therapy. That's how we describe it. Because again, I once made a list of all the different ways people describe it. And there's such a long list. So that's why there's so much confusion out there. That's why the public is like, oh, you do laser? Oh, I have a red light therapy. No, it's not the same.
Well, and then look, I don't want to, I'm not, I think there's value, like you said, to every level of this on something, but you definitely start to see when things become, marketed where practices will say, well, we can just market that we do laser therapy, but let's get the $10,000 one and save ourselves 60 grand and just market it and tell patients like, oh, yeah, it's doing the same thing. And some of that comes from this like complex terminology where it's, they don't know what to ask of what that is. Whereas, if you were going, to the doctor or something like that, and they're like, we're going to give you, this medication, but we're only giving you a tenth of what's actually called for. It's going to create a different outcome. But in these situations, I feel like that happens a lot.
Yeah, we're working on a solution for that right now. I work with offices all over the country under, you can see it on my shirt here, right? The Relief Now. We have Relief Now laser centers all over the country. And the way that I'm starting to teach the doctors to describe that so that there's some standardization is use what the public, what patients are already used to, okay? Use the dosage analogy. And it's not even an analogy, it's dosage, right? Yeah. For instance, let's just say I'm treating biceps tendonitis, okay? The anterior shoulder area. The rule of thumb in terms of treating an area would be 12 to 1800 joules of energy per 60 centimeters squared. Okay, so to make that easy, 60 centimeters squared would be like a Queen of Hearts playing card. Okay. And then 12 to 1800 joules would be, based on the density of the tissue, right? So a patient that's thinner, you would use, more of, let's say, the 1200 joules. In a patient that, had thicker tissue, I would probably use 1800 joules. Okay. Let's go down the middle. Let's say we're using 1500 joules per 60 centimeters squared per Queen of Hearts. Okay. And let's say the area was 4 Queen of Hearts. All right. Which would basically be 6,000 joules of energy for that treatment. Okay. And let's say the recommended, dosage over time is 60,000 joules. So the patient will have a prescription of 10 visits given 6,000 joules per visit. Just like, a doctor would give a prescription for anything, for an antibiotic, right? Yeah. You need to take 100 milligrams of this antibiotic, for 10 days. And that's a way that people can really understand it better. It's based upon, the total joules. And I'll use the analogy of, again, of joules or the comparison to, milligrams of some kind of chemical. So your condition is going to require 60,000 joules of energy. I can't give you 60,000 joules of energy in one visit.
Yeah.
Because that's going to be an overdose, right? Because I just said it's 12 to 1800 joules per 60 centimeters squared. But we know, based upon our experience, that it typically takes about 60,000 joules. So we're going to divide that up into 10 visits.
Yeah.
Okay.
And that the 60,000 joule prescription, that's the thing that would change based on like chronicity, if it's a very acute issue versus a very chronic issue.
And sometimes they need more, sometimes they need less, but this is where we're going to start. Now, this also does solve a problem though, because if a patient comes in and let's just say, they had 3 treatments. So let's say they had 18,000 joules at that point. And they say, well, I'm not really feeling any different. I say, well, you need to finish your prescription. Yeah. What would happen if
don't take 2 antibiotics and be like, I'm still struggling.
Exactly. You have to finish the prescription because laser works for 18 to 24 hours after the patient leaves. Okay, those mitochondria are pumping out energy. And it takes time, for those tissues to heal because, you see, here's the difference between, we were talking about chemistry, right? we want in all of our offices, all the Relief Now offices, want the patients to feel better. There's no doubt about it. I want everybody to feel better. With one caveat, I want you to feel better because you're actually healing better. So the feeling has to be a byproduct of the healing versus the other way around, where, a lot of, it's really based upon, let's just get you feeling better. Let's treat the symptom. Let's mask it. Let's cover it up, rather than getting to the root cause of the problem. And laser gets to the root cause of the problem. But the feeling, some patients may not feel better. They can maybe come in on the 9th visit and say, Doc, I got to tell you, I don't think it's working. I don't feel any different. Then they come in on the 10th visit and they'll say, what did you do last time? Did you do something different? I know you did, or, it could be after the first treatment. We had one patient come in that had plantar fasciitis, the foot pain, since 2006. She had one laser treatment, and she literally danced out of the office and was like, I can't believe, and guess what? She only had one treatment. That was it. And she was great. And we followed up with her. She goes, I'm doing great. Now, that's like what I call like a miracle case.
Yeah.
All right. Like, I've never ever seen anything like that before, and I've never seen anything like that after. But what I'm saying is that some patients respond, early on, 1, 2, 3 visits, they start feeling better. Yeah. And some patients, it takes the whole course of treatment. And some patients, we actually need to do a little extra treatment. But, I'm just giving you, based on averages. But when I describe it that way, in terms of a prescription, in terms of dosages, we get better compliance and the patients get better results.
Well, and I love that, because then I think if consumers start to hear that stuff, then you can kind of make informed decisions. It's like, if they go somewhere and somebody has, a very low level laser for a significant issue, it might be like, okay, well, I heard that this is going to take me 60,000 joules to get this better. How much are you going to deliver with that thing? And can it get to the tissue that we're trying to heal with those? I feel like they start to kind of get empowered in their care in this this arena.
If the patient asks that question with that type of practitioner, with that type of
they're not going to know
laser, they're going to say, well, this is going to take you 5 years, 3 visits weekly to reach that dosage. That's the difference. You see the class 4, or what we call, again, regenerative medical laser, gets you there faster.
When you talk about it working for like 24 hours or so, do you see a dip, like in that 60,000? Let's stay on that for a minute. Do we see a difference in how long that's spread out? Like, if you're doing it every other day versus every day versus one time a week, is it just how long it takes you to get the full dose? What's your thoughts on some of that? I know y'all have a ton of data on hundreds of practitioner hours, thousands of practitioner hours. What's that look like to you?
Yeah, well, so we'll have patient. Listen, I give a recommendation to the patient, and I'll say, we're going to see you 3 visits weekly over, let's just say the next 3 or 4 weeks or 6 weeks, whatever it is based upon the dosage. And the patient, if there's any resistance, if they say, I can't make it in 3 times a week, can I come in twice a week? I just let them know that, we're not going to get there as fast.
Yeah.
Okay. And you may even require a little extra. It's kind of like, again, if you were given an antibiotic prescription and you're supposed to take it every day, let's say for 10 days or 14 days, but you take it one day, then you don't take it for another couple of days, and you're not going to get the same results. It's kind of like, if I got in my car and, drove to see you, okay, I get there a lot faster than if I walked. So I'm going to get there eventually, but I'm all about minimal effective dose. Okay. What's the least amount of treatment I can provide? Okay. In the shortest amount of time to get the most maximal results. That's, the best way to treat, right? Because patients are busy, they have lives. They don't need to they don't need to live in my office, right? We want to get the best results in the shortest amount of time. Okay. And if a patient, can say, I can only come in twice a week or once a week, I say, well, listen, I'll accept your case, but I want you to know that that's not my best recommendation.
Yeah. What is the biggest mistakes that you see early on with laser practice, laser treatments? What's the things that if people aren't getting the results that they want, that y'all see them doing differently than someone who's getting incredible results?
Listen, I always tell the patients, if you fully understand, if you do what I ask you to do and refrain from what we may ask you just to, lay off of right now, and really, completely understand what we went over and what's going to take to resolve your problem, then you're going to get the best results. But, so for instance, let's just say you have a CrossFit athlete and, again, we'll go back to like the bicipital tendonitis or something like that. And, you say, listen, we got to get this area to heal. Could you just maybe lay off the pull-ups, the kipping pull-ups or something, for a while, and any kind of curl, movements, and, so we can let the area heal. If they can't, get that recovery, because recovery is so crucial to the process. So if they're not following, the protocol and the recommendations in terms of allowing the body to recover, then they're going to prolong the process. I'm very into, again, we want you to have an active life. I'm not into, just rest all the time, don't exercise. I mean, then I'd be a hypocrite, okay? Because that's what I do, all right? I mean, I'm always working out and stuff. So, but you have to allow the body to heal. And part of the healing process, a big part of the healing process, is getting the rest and rejuvenation and allowing that mitochondria, again, to produce that energy and allow the area to heal. I mean, listen, a lot of injuries, the chronic repetitive stress type of injury, it's because you're overuse, overdoing it, and the body needs to rest.
And those are some of the best, responding from a laser standpoint is these kind of chronic, tendinopathy, ligament stress, muscle. One of the questions we got a lot on, and I think it's because you put some of this out, and it's also because the medical community says, if you have a disc injury, then you have to have surgery.
I can go. I got a lot of information on that.
Yeah, let's talk a little bit about disc healing and discogenic treatment in this world.
Absolutely.
There's tons of misconceptions. Can a disc heal?
Yes. So let me, I'll get into this a little bit because we actually, again, through our Relief Now laser centers, we have the federally registered trademark for non-surgical laser disc, one word, decompression, okay? We combine laser with non-surgical decompression, and I'll explain to you how that works because we get excellent results with the patients with herniated discs and bulging discs, even stenosis, get really good results with. So when you look at a disc, okay, the disc is avascular, meaning that there's no blood supply. But the paradox is that the disc has to be filled with fluid to be healthy. It has to be well hydrated, okay, and nice and thick and juicy. And how does it get this hydration? How does it stay like a wet sponge between the vertebrae if it's avascular? So there's something called imbibition, which is the medical terminology, but the layman's terminology is the disc pumping mechanism. And what that is all day long, if the disc if the motor unit, the vertebrae above and the vertebrae below the disc, is functioning normally, there's actually a pumping mechanism where very subtly there's a pump between the bones. If I could show this, is like a little bit of like this, okay, and that's forcing fluids into the disc, and it's also releasing waste materials, and that's how the disc stays healthy from past injuries, falls, chronic, just poor lifestyle habits, sitting too much, standing too much, whatever it is. You could lose that pumping mechanism. And when you lose the pumping mechanism, now the disc is more vulnerable to injury. starts to become even more brittle, does not as well hydrated. You could see it on an MRI. When you look at an MRI, T2 weighted image, the discs that are healthy actually have a lot of white space, okay, in the disc. That's hydration. But where they're black, it means not very well hydrated, or would you say desiccated. And that leads to, early degeneration, decay, leads to herniations and bulges. So what we do is we help to restart that pumping mechanism using non-surgical spinal decompression, which are specialized tables. They're computer-driven. They're focused on the level of disc that you're going to work on that's injured. They even have mechanisms to allow for muscle guarding, where they'll lighten up if there's any muscle tension. And it starts to open up and then close a little bit, and open up and close, and it restarts it. The analogy I give, it's like, remember the old Model T Ford cars? And the only way to start the engine, well, you have to crank it up, right? So we're cranking up the disc, we're restarting that pumping mechanism, and then restarting those fluids, getting into the disc and releasing waste materials. And the other thing decompression does is it causes what's called a vacuum phenomenon. Okay, it causes a negative pressure inside the disc, so that the bulge or the herniation starts to get sucked towards the center. Now we either use in conjunction, like during that, because some of these patients we will do when they're face down or in the prone position, we actually have these restraints, these belts that have openings in them. We could do laser at the same time, and the laser component of that is going to get rid of the pain and the swelling and the inflammation and relax all those muscles, and it's going to help to repair and regenerate some of that supporting soft tissue structures. And that's why we call it non-surgical laser disc decompression. And we get very good results with that.
Do you think the laser stimulates any repair to the annulus of the disc or to the disc level? Do y'all think it's getting to that?
I don't have an answer for that. I do know that it addresses, again, the pain and the swelling and the inflammation. From the disc repair standpoint, I would say from my experience right now, it's the decompression component that's doing more. But again, it would be great to have some more research on that, because we really do get really good results than just doing decompression alone. I find that the laser accelerates and amplifies the results. Like in some clinics, like I find that we're typically we're averaging about 20 visits, where the prescription, right, is a dosage of 20 decompression sessions, and again, based on the patient, right, how many joules, okay, that they would need, compared to a lot of colleagues of mine that I've spoken to. The recommendation of care is generally about 24 visits. I've heard 30 visits. So I really do feel, and again, this is anecdotal, but I can see that, again, minimal effective dose. What's the least amount of treatment we can provide to get the most maximal results in the shortest amount of time?
Yeah.
And typically I feel that when I'm offering 20 and a patient comes in the office and says, I did get a second opinion. I went to this other office and they were recommending, 25 treatments, and they say, why is yours less? And I say, well, because again, we're doing the laser disc decompression, and, it seems to shorten the process and get you better results in a shorter time.
Yeah, I love that idea for a lot of the reasons that you've mentioned. If you're doing decompression and you've still got inflammation and those cells are still struggling to work, that's why I ask if y'all see like a faster disc repair.
Yeah, we do. And you were saying earlier, you're talking about like stacking things, right? So that's our stack right there.
Yeah,
and we've trademarked that, because again, in the offices that we have throughout the country, and we are in so many different states, and if it's okay, I'll give a shameless plug right now, but reliefnowlaser.com. If anyone's listening and they are looking to have this type of regenerative medical laser care, they can go to reliefnowlaser.com and find a practitioner. But this is what we're doing. I mean, this is what our offices focus on. This is what we're collecting data. Our chief medical officer is a board certified orthopedic surgeon. We have multiple clinic advisors. We live, eat, and breathe this. This is what we do.
I mean, I love this field of where this is going, as we talked about. And look, I know not every study shows massive effects or incredible effects, and protocols matter a lot. But I think getting people access to the knowledge that it's not just surgery or medication. This next level field of regeneration is going to come. It's here now, and it's only going to continue to get better and more specific to what you got. So I appreciate your passion for this, and y'all thinking about it from kind of the scientific mind and then getting that to patients, as opposed to what we see too much today, where it's a little bit of let's market this and then we'll try and make the science match what we're marketing.
Right. That's backwards.
I love it, Doc. Thank you so much. Where else? I know you put a decent amount of information online. You said Relief Now. Where else can people find more about what y'all do? Any of the updates, any of the treatment stuff, stories? Where can people follow you and find more information?
We have a lot of press out there. We're putting out there all the time. We're going to add more blogs and information to the reliefnowlaser.com website, national directory. I mean, we've only scratched the surface. We have, like I said, in the neighborhood about 60 locations, but we have so many interested doctors because this is next generation stuff. I mean, this is what it is. And we are, like you said, alternative to drugs and surgery, right? That's why we do carry around these coins. It's like, ditch the drugs and skip the scalpel whenever possible, because listen, there's a time and a place for everything. But I was reading a study recently. It was from a couple of years ago, and said 128,000 people died that year in this country from properly prescribed medication. I mean, can you imagine if 128,000 people died from some type of treatment that you do? I mean, there's actually a diagnostic code called FBSS. Do you know what that stands for?
I don't.
Well, let me ask you a question. If there was a diagnostic code for a procedure that you performed that was for a failed procedure, wouldn't that tell you something?
That would be a problem.
Okay. It stands for failed back surgery syndrome. So there's actually a diagnostic code for a failed procedure.
Yeah.
Okay. So, I tell the patients, listen, if we can help you to avoid this, yes, there's a time and a place. Okay. I mean, sometimes, patients need that.
Yeah.
But we also get a lot of patients coming in that already had surgery and they're still suffering.
Yeah.
And, depending upon the type of surgery and the techniques, that we can use, many times we help them get over the hump.
Yeah.
Okay. So drugs and surgery, in my opinion, should be secondary. It's backwards, right? In this country, unfortunately, it's like drugs first, then surgery, then something more, holistic or regenerative. But it should be the other way around. It should be more of the holistic regenerative first, then drugs and surgery.
Right.
Okay.
Yep.
But like we discussst earlier, why do you think that is?
Yeah.
Economics.
Love it.
Politics and economics.
Of course.
That's what drives
Dr. Rob Hanopole, ladies and gentlemen, thank you, man. I really enjoy this conversation, and your passion for this topic and helping patients comes through. So thank you for everything you do and taking the time to do these things. I really appreciate it.
I appreciate you having me on today. This was wonderful.
Loved it.